Maximum airflow resistance seen in nasal cavity at area of anterior, posterior, internal nasal wall and external nasal wall. Answer of this question is the maximum airway resistance in nasal cavity is the internal nasal wall area because this area is the narrowest area in the nasal cavity. The cross sectional area of the nose is very important because it determines the resistance according to Pasolini's law. That resistance is inversely proportional to the radius 4. It means any abnormality like septal deviation, terminate medialization, and hypertrophy of mucosa in rhinitis or any other nasal pathology may lead to increased airway resistance and ultimately lead to nasal blockage. The internal nasal wall is the narrowest segment of human airway and such it is responsible for half of the airway resistance. And it is slit-like triangular opening composed of rigid structure including the entry head of the infinite nasal septum and caudal aspect of the upper lateral cartilage. And this angle is more acute in the Caucasian than the Asian population. So chances are more in nasal obstruction in Caucasian than the Asian population. Pasolini's law defines internal airway resistance in the nasal cavity is inversely proportional to the radius of the cross-sectional area. If this radius is decreased, the resistance is increased in 4 times. It means this increased nasal resistance is also important for the humidification of the air, warming of the air, and if this resistance is increased that much, that may lead to nasal obstruction and rhinitis. So, proper maintenance of nasal resistance in nasal air flow is very important.